Dr. Michael Baker, this is a picture taken with Dr. Baker about 25 years ago. He hasn't changed at all, as you can tell. Michael is not only the physician-in-chief of the University Health Network, but Michael is also the program medical director for the Medical and Community Care Program. That actually stretches across the University Health Network and the Toronto General as well as here, ably assisted by Gene Jabanowski, who's sitting in the back as the executive director of this program. This serves the largest volume of inpatients in our hospital. If University Health Network is to serve efficiently the patient populations that come here, this is the program that allows that to happen. This is the program that serves the 80-year-old grandmother coming to our emergency department with pneumonia, providing compassionate, effective care for that patient, making sure she returns home as healthy as can be is the job this team of physicians takes on, nurses, allied health personnel, not only looking after inpatients, but also providing the ambulatory treatment for patients with chronic diseases such as diabetes, asthma, heart disease, and specifically here at the Toronto Western Hospital, led by Dr. Jenny Heathcott. Jenny, could you just put up your hand? An inspiration in providing excellence in community and multicultural health. In Jenny's case, with patients from the Asian community with hepatitis. As you know, the Western is embedded in a unique multicultural environment and providing healthcare services that are sensitive to serving the needs of that multicultural environment is something that the Toronto Western is recognized for across the Canadian healthcare system. So it's not only emergency departments, it's also chronic diseases such as dialysis, nephrology, a variety of different complex medical care patients come under Dr. Baker's leadership. As mentioned, we also have a family practice unit that serves patients with less acute needs perhaps, but certainly that idea of keeping people healthy is what's concentrated on in our family medicine area. We're also able to support some rather unusual services for hospitals. For example, the Artists Health Center concentrates on the needs of injured and ill artists. The Psychiatric Emergency Services Unit in our emergency department serves as a collaborative effort across the mental health providers in Western Ontario. We're extraordinarily proud to be the home of the Krembil Neuroscience Program, which is recognized across Canada and North America as an international leader in both neurology, neuroscience, and neurosurgery. And you can see the list of conditions that are treated within this program. And you can see the wonderful picture of a neuron. That's a neuron, by the way. That's not a roller coaster on the right-hand side. Trying to improve the coordination of those neurons is what the Krembil Neuroscience Center is about. The Krembil Neuroscience Program is led by Dr. Michael Failings, an international expert in spinal injury. And Michael has built Canada's leading spinal program, providing, as you can see, almost 1,000 spinal surgeries a year, as well as leading a very dramatic research program looking at the use of stem cells and new medications to treat spinal cord injuries. But that's only part of the Krembil program. We'd be proud if we simply had the spine program at the Toronto Western. But not only that, Tafiq Valiente leads an epilepsy program which concentrates on surgery for patients who can't be controlled with epilepsy drugs alone. The only epilepsy monitoring unit in adult hospitals, trying to concentrate on earlier diagnosis and identification of people appropriate for epilepsy surgery. Tony Lang leads Canada's leading movement disorder program, which relates especially to Parkinson's disease, a huge outpatient program that's not only treating patients with the best available medications today, but also through investigation looking for new drugs that will treat Parkinson's disease with fewer side effects. Again, that concept of translational research moving from the lab to the clinic. Now, Mark Bernstein is the surgeon that you can see here who was featured in the Toronto Star a couple of months ago. He is the leader in the world of providing very advanced neurosurgical removal of tumors with the patient awake rather than anesthetized. You can imagine, first of all, you wouldn't want that procedure, but God forbid, should you have a brain tumor, the one thing that you would want to do is have that tumor removed with as little brain damage as possible. And by operating with the patient, appropriately relieve the pain, so not able to feel, but able to respond to signals during the time of surgery Dr. Bernstein is able to provide a more complete operation while preserving as much function. He's the one that introduced this procedure around the world, and this past year published the first paper describing his results in literally hundreds of patients treated. This treatment was now used for Teddy Kennedy, for example, at Duke University. So the treatment that Mark pioneered here has now been adopted as the standard of care literally around the world. Neurovascular disorders, stroke, aneurysms. We've really invested tremendously at the Toronto Western Hospital, taking patients out of the operating room and allowing us to treat their vascular diseases, blood vessel diseases of the brain, with imaging and radiology techniques without making incisions or opening their heads to treat these conditions. And Carl Terbrug leads this program. He's a radiologist, which really has taken a lot of patients out of the more morbid treatments of surgery into treatment within the radiology suite. Many of you have seen the Gamma Knife Center just outside the Nassau Street entrance to the Toronto Western Hospital. This is the only Gamma Knife in the province. Patients are referred here from across the province, treating a variety of both tumor problems as well as some functional problems of the brain and central nervous system that can be treated by focused radiation treatment. This is a collaborative program between Toronto Western Hospital and Princess Margaret. And if you ever see an advertisement for behind the scenes in the Gamma Knife Center, come to that. It's spectacular technology to visit and an excellent tour. Thanks to Don Johnson, we're able to celebrate this year, the opening of the Donald K. Johnson Eye Center, led by Dr. Rob DeVenye. And again, this is a center concentrated on translational research, identification of causes of blindness, one of the major causes of disability in our aging population, developing new treatments that will eliminate blindness as a cause of disability in our populations. Rob does a superb job, not only of leading the clinical care, which is enormous here, the biggest eye center in Canada, but also inspiring that translational aspect of research for his patients. Now here's a man who truly has global impact. Anders Lozano is a man who, along with Sid Kennedy, our UHM professor of psychiatry, thought that he could identify a zone of depression in the brain, and by a variety of scanning techniques was able to do that. It is now shown by inserting electrodes into that center for depression in patients with refractory depression that's been present despite medications, electroconvulsive therapy, shock therapy for years. He's able to bring these patients back to work, take them off their pills or reduce their pills and bring them back to life. This is an experimental therapy that's now being practiced under clinical trials across North America. We're delighted that it's inspired and driven by investigations done by Dr. Lozano here, and these clinical trials are led by the Toronto Western Hospital. In terms of global impact, it's important that we not only make discoveries here that transform care across the world, but also that we develop new methods for sharing those discoveries. This is Dr. Alan Napranik, a minimally invasive general surgeon. This is a person who, instead of opening someone's tummy to remove a gallbladder or take out a tumor, actually puts telescopes into the stomach and small instruments that allow him to do that work while looking at a TV monitor of what he's doing. And the extraordinary thing that you see here is that this person isn't at the Toronto Western Hospital. This person's in Botswana. And he's conducting a training program here in his surgical simulation laboratory at the Toronto Western Hospital. He's actually teaching surgeons by internet connections in Africa how to do this surgery on similar simulators. So a remarkable example of global impact. And perhaps an even better, more heartwarming example of global impact. This is Mark Bernstein, who I mentioned to you earlier, is Canada's leading neurosurgical tumor surgeon. And he's also China's leading neurosurgical tumor surgeon. He went to China to show a variety of universities how to do his technique of awake tumor surgery. And here you can see a young 16-year-old woman who had a large malignant brain tumor that's been removed by Dr. Bernstein, assisting and teaching Chinese neurosurgeons how to do his technique. It certainly has made a huge difference in this young woman's life.